so far. So tonight, for the next half an hour, I'm going to be talking about the role of hormones in our brains. Because when I've done my survey, I did a survey for the launch of my book, looking at looking at nearly 6,000 women who were perimenopausal and menopausal, and looking at the symptoms. But also I've seen thousands of women through my clinic, so have all the doctors that work with me as well. And we know that the commonest symptoms during perimenopause and menopause are those that are affecting our brains. For many years, we've been told it's about flushes and sweats, vaginal dryness, maybe low mood. But actually, for centuries, women have been describing the changes that are occurring in their brains. And so symptoms such as brain fog, inability to think clearly, low mood, anxiety, feeling overwhelmed, just not feeling happy with life. A lot of people say they feel that they're thinking in black and white rather than colour. They're existing, not living. Their zest for life has gone. Some people are finding that their sleep is not good as well. So all these are symptoms that are affecting our brain. Because to our ovaries not working well, somehow we've then become fixated in thinking about ovaries and our womb and what our periods are like. It's still been this thing about vasomotor symptoms, hot flushes and sweats, but that's been really the main brain symptom that people have described over the last few decades. Whereas we have to remember what women are experiencing. When women are experiencing, and men are experiencing something that we're not sure why, we need to think back, why could it be happening? Think about the pathology and the physiology. Now, as many of you know, what happens during perimenopause and menopause is our hormone levels decline. 3 hormones: estrogen, progesterone, testosterone. They are made in our ovaries, and our ovaries don't work as well as we age, or if the ovaries are removed, and those hormone levels decline. But as I've said before, and many of you probably know, our hormones, estrogen, progesterone, testosterone, are also manufactured in our brain cells. So they're made in our brains. We can't blame our ovaries for everything. They're also made in other tissues and organs in our body. But I really want you to think about our brain. So if we have cells in our brain that are producing estrogen, progesterone, testosterone, they're not just doing it for a bit of fun. They're doing it because they have important biological roles in our brains. And as people, we can't function if our brain doesn't function properly, and our brain coordinates everything we do in our body. So it's not just about flushes and sweats, and flushes and sweats originate in the thermoregulatory part of the brain, and it is an important area, but then so is our whole brain. And if you think of our brain, there are different areas of our brain that have different functions. So some areas of the brain determine our personality, our mood, our memory, our ability to have emotions, our ability to enjoy things, and our ability to be upset. All these different areas of our brain, but also the way our vision is, the way our hearing is, the way our taste is. Also, areas of brain determine our heart rate, our respiratory rate. Other areas determine every time I'm moving my hand, it's my brain that's telling me, it's not my hand, it's my brain that's determining it. Also, the way that our nerves work and our muscles work, all determined by our brain. And so quickly, I'm sure you realise anyway, that the brain is a really important organ. There is also blood supply that goes to our brain, feeds the brain with the nutrients and glucose that we need for it to work properly, and then drains away the waste products, if you like, to go back into the body. That's really important as well. So we need to have a good blood supply with healthy nutrients to our brain, and we need our brain to function. And there are lots of hormones that work in our brain. There are lots of neurotransmitters, chemicals that send signal to one area of the brain to another, and a lot of those are hormones as well, including estrogen, progesterone, testosterone. These hormones don't work in isolation either. So if you have a good level of one hormone, you're likely to have a better level of another. And that's really important when we think about how hormones affect our brain. Now, our brain's like something called homeostasis, which is when everything is nice and steady and constant. Some of you might have experienced that sort of hangry, where you feel hungry and angry together. And that's because the sugar levels in our brain is dropping, our brain can't process things quite so well, and so we experience these different emotions, if you like. Exactly the same, many of you might be or might have been perimenopausal, where your hormone levels are really fluctuating. When they're fluctuating, that can cause changes in the brain, and the brain doesn't like it, so it can express itself, if you like, in many different ways. Many of us, myself included, have had episodes of feeling incredibly angry, very short-tempered, very cross for no reason really, or it might have been a small reason that's triggered it, but the brain decides to give you control where you can just be really cross and angry and horrible to people. And that's again because the hormone levels are fluctuating and changing, and also when the hormone levels are low as well. We don't know whether it's the absolute level that can trigger symptoms or the changing levels, but I'm pretty sure a lot of it will be to the changing levels of hormones, because like I say, when everything's steady in the brain, it doesn't have as much effect as when there's a variation in levels. And a lot of people find that their symptoms of anxiety, memory problems, irritability, low mood can be worse during the perimenopause than in the menopause. In the menopause, hormone levels are low and stay low forever, and the brain can accommodate more easily when hormone levels are constantly low, and some other hormones and neurotransmitters often will take over. But we need to be thinking how to protect our how to protect our brain. It's really important, especially as we're living so much longer, that our brain stays as active and healthy as possible for as long as possible. Because we're living so much longer, we have a longer exposure to not having hormones, but also a longer exposure to chemicals, if you like, that can detrimentally affect our brains. Now, we know as women, we're far more likely than men to get dementia, and there are lots of reasons why this might occur. I was taught at medical school it was because women lived longer than men, but actually we don't live that much longer, and the incidence of dementia is so much higher that we can't say it's just because we live longer than men. Obviously, we know there are certain things that can contribute to dementia, such as if people have very inflammatory diets, if they've got raised blood pressure, if they've got cardiovascular disease, because again, if the blood supply to the brain isn't as good, it's not likely to work as well. So if people have narrowing of the arteries, they might have raised blood pressure, they might have had a stroke before, areas of the brain might not work so well, so that's no surprise. We know that if people exercise well, if they eat healthily, that's going to reduce inflammation, help the brain to work. But guess what? Hormones as well do have a role with dementia. We've known for many, many years that the longer a woman is without her hormones, i.e. the longer she is menopausal, the greater the incidence and the risk of dementia. So if women are young when they have their ovaries removed under the age of 40 and don't have those hormones replaced, then there's an increased incidence of dementia. That is just fact, because we know how neuroprotective, so protective of the brain and the nervous system, our hormones estrogen, progesterone, testosterone are. But it's been neglected for so many years because people have been thinking only of the hormones related to our ovaries and our womb. So it's really important we think about it. Some of you might have seen this before, which is a picture from Lisa Mosconi, the neuroscientist, who some of you might have heard of, looking at how the brain, it's like a heat map really of the brain, showing how much more blood supply and activity there is in the brain. So this is before the menopause. You'll see a lot of red areas where the brain is very active. And then after the menopause, it's colder. There's less activity in the brain because there are less hormones in the brain. And that's really important. Obviously, postmenopausal women can still function. Of course, their brain can still function, but it's not as active as when people have those hormones in place. And we know that our hormones are very neuroprotective, and there are lots of papers. This is just one of many papers that I've read, and it's entitled The Neuroprotective Actions of Estradiol, which is the healthy anti-inflammatory type of estrogen, and estrogen receptors. And estrogen receptors in our brains, which are what the cell has on the outside of the cell membrane, where the estrogen and the estradiol sort of locks onto to form these reactions, has a huge effect. And when the estrogen is working through that cell membrane and into the cell, it also helps other organs to work. So our brain determines, for example, how our kidneys work, how our liver works, how our heart works as well, and our metabolism in our body. So it's really important that we have to be thinking about how our hormones work in our brain. But also these are about how the hormones that are made in our brain work as well. I was lecturing to some psychiatrists on Friday, and very few of them actually, I'm not sure if any of them did, realise that hormones can be produced in our brain. And it's really crucial when we think about brain function. It's also very important, and it's highlighted again in this study, that the level of hormones in our brains are not the same as the level in our blood. And that's important because many people are having blood tests and being told their hormone levels are normal, therefore they can't be menopausal or perimenopausal. But actually what's in their blood is not the same as what's in their brain. A lot of women have symptoms affecting their brains before their periods change, before they might have other symptoms as well. And so we have to be having a low threshold for thinking, could any of these emotional changes or mood changes or memory changes be related to hormones? And often it can be, even in younger women as well. So when I'm talking about hormones in the brain, I'm not just thinking about menopause and perimenopause, I'm thinking about women who have periods, so women who have PMS and PMDD. And I've shown you this before, but again, this shows how our hormones change throughout our menstrual cycle. And most women, not all of course, if you go through a calendar month, so from 0 to 28 days, day 1 is the first day of their period. So the first half of the cycle, they have a little blip, and then suddenly there's an increase. But I've done this more to scale. So this shows the progesterone goes really high in the second half of the cycle and then goes down very quickly. The estrogen does the same, it goes up and then goes down as well. But this downward motion of progesterone and estrogen towards the end of the menstrual cycle, so before periods occur, can really trigger a lot of symptoms in people. And I know many of you have asked about PMS and PMDD. PMDD is a more severe form of PMS. PMS, premenstrual syndrome, affects about 90% of women, yet most women are finding it very difficult to be listened to. But you can imagine the brain will really respond to this big drop of hormones. And so sometimes when people have PMS or PMDD, we just give those hormones for a few days just to top it up, the levels, and that can really make a difference, especially to the psychological symptoms. So it is really important to be thinking about how we can get hormones into our brains. The other paper that I did put out on my Instagram over the last week or so was this paper that's come out, and it's called Premenopausal Bilateral Oophorectomy and Brain White Matter Brain Integrity in Later Life. So basically what it's saying, premenopausal is before menopause, before perimenopause, so young women who have both their ovaries removed. So what they did is they looked at young women who had their ovaries removed and see how their brain changed. And actually it showed that they had shrinkage of their brain without their hormones. And other studies have shown this as well, that there are a lot of inflammatory changes that occur, increased risk, like I say, of diseases, but this is actually showing how the brain changes without hormones. I'm not meaning to scare you, but I'm just really important that people know the facts, because for so long people have ignored the impact of hormones on our brains. And I think that's because people haven't realised. But if you read the literature, it's been well documented for many, many decades about how important our hormones are in our brain. And there's some pictures here that I have showed you before, but I've got no problem showing again, showing about how different brain cells, so these are great shapes of cells in our brain. So we've got astrocytes, microglia, we've got dendrites, we've got the neurons, and they're all here affected by estradiol. And the estradiol comes along in the blood vessels, goes down into the cells, really making an effect. But these cells are also producing estrogen as well. This is only about estrogen, but it's exactly the same for progesterone and testosterone. And this is another picture of a cell, an astrocyte, and it's showing all the effects that it has, estrogen has. So it reduces something called oxidative stress, it will reduce inflammation, it protects the nerves as well, it reduces swelling, it also reduces the proliferation of cells in the wrong way as well. So it will reduce all this inflammation, and inflammation can cause lots of diseases as well. It also helps trigger a lot of healthy chemicals, which will again have a neuroprotective effect. Really important, but not just excuse me, not just estrogen, but progesterone and testosterone have very anti-inflammatory, calming effects in the brain. And if the brain needs to repair itself from an injury, something like a head injury or a stroke, then our brains produce more of these hormones, estrogen, testosterone, and especially progesterone, to help repair the brain. So it's really, really important. Then we need to know that it's the balance of estrogen and progesterone, and I've shown this picture before as well. Again, showing how estrogen and progesterone have different effects in the body and in the brain, and it's important, the balance. And I've done an Instagram live before talking purely about progesterone, because so many people think progesterone is just to protect the lining of the womb, and of course it's not. I've already said it's produced in our brains as well, so many people benefit from progesterone too. But estrogen and progesterone often have a really fine-tuning balance, and so some people don't feel completely well until they've got adequate progesterone with their estrogen, and also, like I say, thinking about testosterone as well. Now, our hormones that are produced in our brain, some of you might have heard of something called LH and another hormone called FSH, so luteinizing hormone and follicular stimulating hormone, and they are produced in our hypothalamus, and they have a feedback system. So if our hormone levels of estrogen are low, then often we get a raised FSH and LH, but it can fluctuate and it's very pulsatile, and that's why having a blood test is just a snapshot picture, and it can be really misleading actually if we take the blood test and say, well, it's normal, it's not raised, therefore you can't have low estrogen levels. It's not actually true. FSH and LH vary so much between people, and there isn't good studies to show that a certain level means that someone is or isn't menopausal or perimenopausal. There are other symptoms that can occur in the brain which are really common actually, and often misunderstood or mistaken for not being related to hormones. Many of you know that I suffer with migraines, and migraines can be very common during perimenopause and menopause. Partly our hormones are very anti-inflammatory, like I've said. They can help with dilating the blood vessels. They can also, when we have fluctuating levels of hormones, this can definitely trigger migraines. So a lot of people find that migraines get worse during the perimenopause and menopause, but also people might find that they have worsening migraines before their periods. So a lot of people might be young and they might find that they just have headaches and migraines before their periods are due, and again that's due to the changing hormones and the lower levels, especially of progesterone as well. So if you've got teenagers or you've got younger relatives or friends who are experiencing headaches and migraines, or migraines or both, and they have a cyclical pattern, then that's when we need to be thinking, could it be related to hormones? And that's why I would really encourage many of you, whether you've perimenopausal or not, to download Balance app and to start logging your symptoms, because looking for a cyclical nature of any symptoms can be really important for us as clinicians to try and diagnose. So headaches, migraines, like I say, people might find that they just sleep really badly just before their periods, and again that's a sort of sign that it might be related to hormones. The other thing that some people have asked is about is ADHD, or symptoms related to OCD, obsessive compulsive disorder. And a lot of people find that they get diagnosed as having ADHD when they're perimenopausal or menopausal, or those symptoms can worsen. And again, it will be related often to hormones because of the changing hormones. And we see a lot of women who find that their symptoms really do improve when they've been given the right dose and type of hormones, especially progesterone and testosterone, which are very calming on the brain as well. Quite a few of you say you're already on HRT, but you're still experiencing symptoms, and how do you know whether it's related to hormones or not? Often it's impossible to know, but everyone's different and their requirements for hormones are different as well. And I have done an Instagram live talking about different doses and types of hormones, and often symptoms might reappear when you're on HRT. If you feel they're related to your hormones, you are probably right. And so improving the doses and types of your hormones are really important. Our hormones are very short acting. They don't last very long in the body. And so it's very safe to try using a different dose under the direction of your clinician, of course. So some people find that having a higher dose of estrogen means that it's more effectively absorbed through the skin. And we need to get it through into our brain when we're thinking about brain symptoms. We've got something called our blood-brain barrier, which basically protects our brain from anything just going up into it from the bloodstream. So often people do need higher doses, and there's been some work from many years ago actually showing that people with schizophrenia respond better to higher doses of estrogen than those on a sort of more standard dose. There's so much we don't know because people haven't done adequate studies about looking at mental health and hormones, and we really do, because we're doing people an underservice if we are not prescribing the right dose of estrogen, progesterone and testosterone. Our clinical data is very clear that women's mental health can really improve with testosterone when given in addition to HRT. Yet for many people, they think testosterone is only for libido. Of course, it works everywhere on our brain, so it's no surprise that mood, memory, concentration, stamina, enjoyment of life can improve with testosterone. And so there's no harm in trying testosterone, making sure it's absorbed by having a blood test, and then seeing if symptoms improve. And certainly many people find that testosterone can actually make a really important additive improvement to symptoms if you're having testosterone addition to your HRT. If you've got a marina coil-in or had a hysterectomy, you can still consider progesterone as well. So it's very important having the balance of hormones. Some people have asked about how long can you be on hormones and testosterone once you start. Well, there's no upper length of time because these hormones are very safe. The natural body-identical hormones are the same structure as the hormones we produce ourselves. So there are no risks with them, there are only benefits. And so as long as people are reviewed, they're usually reviewed every year, then usually people can continue. Some people have asked about what about starting in older women, so women who have missed out on HRT, who might have some cognitive decline or mental health issues, there isn't an upper limit for starting HRT. We're very lucky because we've got the natural hormones now. We can start at a low dose and gradually increase. And one of my colleagues' mother actually has early onset dementia, and she was taken off HRT 20 years ago, and then she really declined both physically and mentally. So we've restarted her on a low dose of hormones, we've added in some testosterone, and actually it's really stabilised her dementia to this extent that she can carry on living at home. She's recently actually had quite a nasty fall and didn't fracture her pelvis or hips, which the orthopaedic specialists were quite surprised because it was such a nasty fall. But more importantly is that she hasn't got worse, and that's really important. So we know that hormones can still have an effect on the brain in older people. So I feel quite strongly as doctors we shouldn't be refusing people a trial of hormones. Lots of people have trials of antidepressants, other medications, painkillers for example, migraine medication. We're always trying medication. But HRT isn't really medication, it's just replacing the missing hormones. And so often it is safe to try them and assess and see whether people can improve or not. I'm also aware, before I finish, that people have asked me about what if I've had breast cancer? What if I've been told I can't have HRT? Now, there's very few people who absolutely can't have any hormonal treatment at all. There's often people who've had clots or other types of cancer, for example, cancer of the cervix or a bone cancer or a bladder cancer, who have been incorrectly told they can't have HRT. There's never been shown to be a risk of having HRT for those women, especially if it's given as estrogen through the skin, as a patch or gel, the natural progesterone or the natural testosterone. Women with breast cancer, as I've said before, is very individualised, and I have spoken about this at length before. Increasingly, with women who've had an estrogen receptor positive breast cancer, we give testosterone alone rather than giving HRT, because HRT contains estrogen. Some women are on a aromatase inhibitor, which is blocking the conversion of testosterone to estrogen, and many women have been told that you shouldn't really have estrogen. Now that really varies, and it depends on the type of cancer, how long ago it was, what symptoms you're experiencing and so forth. But because if, for example, someone's on an aromatase inhibitor, it's blocking the conversion of testosterone to estrogen, having testosterone is still going to block the conversion to estrogen. So a lot of oncologists are quite happy, and it does make sense to try testosterone on its own. And we know testosterone can be very anti-inflammatory, like I've said. It can actually, there is some work to show that women who have an aromatase inhibitor with testosterone have a better outlook in view of their breast cancer. But using a low dose of testosterone might often improve some of the brain symptoms that can occur during perimenopause and menopause. So it is an option. It's not in the guidelines, but guidelines are there to guide. We're learning all the time from clinical experience and knowledge, and also looking at basic physiology too. So if you feel that you would like to try testosterone, then it is worth going to a specialist menopause clinic, speaking to someone who really understands hormones as well. If you've had your ovaries removed for whatever reason and you haven't been given replacement hormones, you have to have a really solid, good reason for not having hormones, especially if you're young, because you're basically denying your body of hormones that your body would otherwise be producing. If people need psychological or psychiatric treatments for their low mood, their anxiety, their psychiatric mental health condition, it's absolutely fine. So antidepressants, antipsychotics, other treatments will not negatively interfere with HRT. And actually, we know from some studies that women who take antidepressants alongside HRT have a better effect of their mental health symptoms improving than those who are only on one or the other, because having estradiol on board will enhance the efficacy of drugs, especially SSRIs. So if any of you are being treated with antidepressants and you're not on HRT, you should be thinking, should I be on both? And sometimes when people are on both, they start to feel so much better that they can gradually, under medical supervision, reduce and stop their antidepressants and other sort of antipsychotic medication as well sometimes. But again, it has to be done very gradually under medical supervision. Somebody asked about Tibolone instead of HRT. Now, Tibolone is a very synthetic combination type of hormone. We tend not to prescribe it as menopause specialists in our clinic because we really like to individualise care and give the individual doses of estrogen, progesterone, testosterone, rather than giving something that's combined, because then you can't tweak and change the dose for that individual. So lots of information. I hope that's been helpful. What I tried to do initially was just to describe some basic physiology. There's a huge amount of information, but there's a lot of information that's available online as well. And I will share some resources later on my Instagram live. But I just want you to think differently, think more openly about hormones, think about what they do in our body. And then it's easier to understand what happens when those hormone levels are low and what do you want to do about it. And you should be making a choice, because after all, it's your body, not the doctor's body. So enjoy the rest of your evening, and I will see you next week. Take care.